Today I saw a gentleman who is about 67 years old. He came to me with a very peculiar complaint. He has got bilateral burning sensation in his sole of his feet. He is not a diabetic. He has undergone a blood checkup and then there is no diabetes. So they told him to do an X-ray. So the X-ray is here. You could see the X-ray shows multi-level disc degeneration. Of course, it is okay for a 67-year-old man who has been a heavy worker all his life. So this is acceptable. What I want to make a point here is the reason for the burning sensation in his feet maybe could be because of the nerves which are getting compressed in the lumbar spine. How do you know that? If you see the intervertebral foramen space here and here and here, these are all good. Whereas in this level, the foramen space is narrow. The foramen space is even more narrow here. So what should be normal is this. See the space for the nerves to exit out of the spinal canal, and the space for the nerves to exit out of the spinal canal is pretty narrow here. The nerves can be exhibiting the problem by various ways. It can be tingling, it can be numbness, it can be paresthesia, it can be pain on touch, it can be sensitivity, it can be even burning. Because there is no other structure in the body which can cause burning sensation than the nerve. Because he has got burning sensation in the sole of the feet, because his X-ray is also quite stating the same, that the nerves are disturbed in the lumbar spine. Here we made a diagnosis as the lumbar radicular pain, which is acting as a burning sensation in the sole of the feet. So whenever there is a burning sensation in the sole of the feet, people think that it's because of vitamin B12 deficiency, it's because of maybe diabetic neuropathy or senile neuropathy, which is age-related neuropathy. But before you jump into such conclusions, make sure that the nerves in the lumbar spine is intact or not, because most of the burning sensation happens in the feet or the sole of the feet is because of the problem in the lumbar spine nerves. So this is the most common reason for the radicular pain, radicular symptoms, compared to the systemic problem like vitamin B12 deficiency, calcium deficiency, or even diabetic neuropathy. But everybody are thinking in that terms. Except diagnosing the lumbar spine, they do everything. So if you see the space between L3, L4, L4, L5, L5, S1, in L3, L4 the space is literally nil. Bone to bone contact is there. Sclerosis of the vertebral margins, that's why you see the shiny bone, that shiny bone margin. You see the shiny bone margin, that shiny bone margin is sclerosis of the vertebra. Sclerosis is an indication that there is a wear and tear happening over there. Otherwise we call it as an arthritis of the lumbar spine. In lumbar spine we call it as lumbar spondylitis. We don't use the term arthritis in the lumbar spine. The same arthritis happening in the lumbar spine, we call it as a lumbar spondylitis. So the lumbar spondylosis, due to the disc degeneration, that disc degeneration is reducing the vertebral disc height. That reduction in the height is also reducing the canal diameter. Also the canal diameter can be reduced because of possible disc bulge, which can herniate posteriorly and reduce the space in the intervertebral foramen. That I am not able to comment because we don't have a MRI scan right at this point of time. Here is the AP view of the same patient. What we see in the lateral view is what we are as well seeing in the AP view, in the form of space reduction between L3 and L4, and there is also a slight lumbar scoliosis over here. And then you could see the sclerotic markings in the borders of the all lumbar vertebra. So that says that he has been having degenerative multi-level lumbar spondylitis, and he has been having this pain for the past 20-25 years. Now the back pain is showing in the form of radicular pain, especially in the form of burning sensation over his feet. So these problems are mostly chronic in nature, but most people will be ignoring in the initial form and then coming to us in the end stage. We at present told the patient to do the decompression exercises and some spinal correction exercises to see whether the burning is improving. He is responding pretty well now with the exercises. The burning is reducing. So I hope that he will be fine one day. This video I made to make you understand that the burning sensation can be neural. Neural means it's mostly the spinal. Once you rule out the spine, then you go to the system. Okay.